Today we're diving into exercises for L405 disc bulge, and more importantly, how to start without making it worse. Using the spine model and these anatomical charts, I'll break down and illustrate exactly what's happening to your spine, muscles, and discs when you perform each of these exercises. But I warn you, if you skip out on just one part of this video, it could be the difference between achieving the relief that you need and want and missing out on it. Not only am I going to explain these beginner L405 disc bulges, but watch right to the end because I'm going to be guiding you through a complete, uninterrupted follow-along routine. And then I'll give you the exact number of reps, sets, and frequency, which means how many times in a day and in a week you should be performing these exercises. Why should you listen to me? Hey there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And with over 23 years of clinical experience, I've helped hundreds of people recover from L405, L5S1 disc bulge using chiropractic techniques and similar exercises that I'm about to show you in this video. Now, before we dive in, I need you to smash that subscribe button down below if you want to get more tips, strategies, and exercises for relieving spine-related pain. Like this, you can live a normal life again. I literally upload a new video every week. I'm going to give you 5 exercises in this video, 2 for mobility, 1 for flexibility, 1 for strengthening, and 1 for stability. Let's get started. The first exercise is called cat-camel. It's a great exercise for the mobility of your lumbar spine, your pelvis, and also your thoracic spine. Relieves a lot of pressure in those lower discs, the lower lumbar discs. I will demonstrate the exercise now and then show you on the spine what it's doing and also in the anatomical charts. So watch this. Get on your knees and on your hands in kind of like this box position, and you're going to do 2 movements. One, you're gonna round the back like a mad cat, and the next one, you're going to arch or dip your back, okay? So round the back, arch and dip, round, just like that, okay? Make sure you get the pelvic mobility in there as well. That feels really good. So this is what's happening in the cat-camel exercise. Let me use the spine model here. So here's the lumbar spine, and remember, you're on your all fours, so you want the lumbar spine to get into extension. That's what's happening. Your lumbar spine is going into extension, which is good for discs, and then you get that flexion of the pelvis, again, to relieve pressure in that lower disc, okay? So not only is it getting mobility in the spine, the mobility is also getting fluid imbibition, water imbibition into this, which is important. You're getting those joints moving. A lot of times there's degeneration of the joints. You're getting a nice little stretch in there, good mechanical input, movement input into the lumbosacral area and L405 area. So that's what's happening with the cat-camel. And of course, in the thoracic area, when you're doing the angry cat and then the camel, you're arching, good release in the thoracic area, good stretch along all those muscles. Over here on this chart, there's the disc. Every time you're bending the spine in that cat-camel position, you're getting that disc moving and pumping and getting nutrients drawn in. So that's what it looks like on a spine model. The next one is a seated pelvic tilt. It's a variation of the cat-camel exercise, but you're going to be sitting and focusing predominantly on the pelvis area. I give this to all of my disc bulge patients and they love it. So this is how you perform the seated pelvic tilt. Sit at the edge of your chair. Make sure you're completely level with the ground, 90 degrees, and you're going to arch your back and then round the back. Get the pelvic tilt in there. Just like that. Feels really good. Now I warn you, with both the mad cat and the pelvic exercise, if you're doing this and you feel a shooting pain into your leg, then you don't go in that direction. Go away from that, okay? Or avoid that direction that's causing any aggravated pain in the back or the leg. That's very important. And again, watch the end of the video for all the sets and reps and frequency for this exercise. So that's how you perform the seated pelvic tilt, which is a great exercise for L405, L5S1, disc bulge relief and related symptoms relief. Now with the seated pelvic tilt, this is what's happening. So now you're sitting, so your spine's upright. All the motion is in the pelvis and lumbosacral joint. Tilting forward, tilting back. Tilting forward, tilting back. You got your proprioceptors are activated because you're upright, right, versus being on all fours, right? You got nice mobility in that lumbosacral joint, good pelvic coordination. Oftentimes, there is a lack of pelvic coordination in people with back injuries and disc injuries, so that helps increase that mechanical coordination, right? And that's very good relieving to the disc. With my patients, when I give them this exercise, sometimes I'll get them to tilt in the opposite direction of their leg pain to relieve. So if there's right side of leg pain, they're doing a pelvic tilt to the left and a pelvic tilt reversed posterior. That will help relieve the one side of the leg pain. So great exercise. That's what's happening in your spine when you're doing that exercise. The next exercise is for flexibility. It's called lumbar extension. You're gonna lie on your stomach, on the floor or on your bed. Start off like this, hands by your side, and lift your chest off the table and just rest on your elbows like this. You relieve the pressure in the disc, help decompress that disc. Relieve symptoms in your back and in your leg. If it aggravates you, again, warning, if it aggravates you, then you need not do this exercise. Back down, up, if you want to add a bit more advancement to this, get up on your hands fully, a full lumbar extension. And again, watch to the end for all the reps and sets and frequency. Now with lumbar extension, you're also getting really good extension into the lumbar area. So you're elevating your chest off the table and you're getting extension like that. So if there's a posterior disc bulge, then that's gonna help relieve that pressure in the area and try to push that disc bulge more anterior, okay? So that's a lumbar extension. So you can see all these exercises are complementary. That's why I give them to my patients. So that's why I'm recommending them in this video. They're all very similar, but they're doing things in a different fashion, but targeting the same tissues. So that's lumbar extension. That's what's happening with your spine and lumbar extension. The next one is for strengthening. I give this one to all my patients when we get to their core strengthening phase of their care. It's called prone cross crawl. It gets all your back extensor muscles activated, your gluteal muscles activated, your lumbar extensors. It's really, really helpful for that strengthening of the lower back. So let me show you how to do the prone cross crawl. On your stomach, hands out, feet out, and you're gonna alternate arm and leg. All right, and again, watch to the end of the video. I'll give you all the sets, reps, frequency, and also a complete guided follow along routine, uninterrupted. Now, the best way to show you what's happening with your back and your muscles during the prone cross crawl exercise, let me use the muscular system anatomical chart. So here is your back muscles. Now the back is made up of the erector spinae muscles, which keep your spine upright and allow you to extend. So these muscles are all activated during the prone cross crawl. So very important. It's kind of like it's part of the core exercise routine. Also, you're activating your gluteal muscles, your gluteus maximus muscle, which is the major extensor of your thigh. Oftentimes they're sleepy and dormant when there's back injuries. And you're getting some upper thoracic shoulder activation as well. So prone cross crawl is going to activate this entire muscular group over here. And in doing so, keeping the back stronger and more stable to prevent injuries. The next exercise is for stability. Activating the multifidus lumborum muscle, which is a primary stabilizer of your back, super important for disc rehab. You're going to be standing like this. It's called lean over the cliff. So imagine that you want to look over the edge of a cliff. You're going to lean over, but you're not going to fall over. Okay, you're going to support yourself with your back postural muscles, your multifidus muscle, and all your postural muscles. This is how it's done. I feel my back muscles and my multifidus muscles activated, so I know that I'm doing it right. Okay, that's how you perform the lean over the cliff multifidus stability exercise. Again, watch the end for all the sets, reps, and again for the complete, thorough, guided follow along routine. Now, the lean over the cliff exercise is a stabilizer, not so much a strengthening exercise. It's super important, and it's going to activate the multifidus lumbar muscle. Now, you're not going to see it here, but the multifidus lumbar muscle is deeper in these lumbar back muscles, okay? So the prone cross crawl will activate more of the superficial muscles, intermediate muscles, but the lumbar one is deeper. It's a stabilizer of the spine. And when you're doing the lean forward, lean over the cliff exercise, you're getting that muscle activated. And the more stable your spine is, the more stability there is, the stronger it's going to be, and also less likely of injuring it again in the future. Weren't those amazing exercises? I want to hear from you now. Comment below and tell me which exercise you like the best. Which one did you try? Was it the cat-camel mobility exercise, or was it the prone cross crawl strengthening exercise? Comment below. Also, if you got value in this, do like it. It helps in the YouTube algorithm, and share it with someone that may need this. And don't forget to subscribe to get more exercise like this to save your back and relieve your pain. I'm going to give you the sets and reps and frequency just in a moment, so keep watching. Let me take you through a guided, complete, thorough follow along, uninterrupted right now. Wasn't that awesome? Now, here are the sets, reps, and frequency. So I'm gonna go down one at a time. Cat camel, 10 repetitions. One set of 10 repetitions. You can do it once a day or even twice a day, and you can do it every day of the week, morning or afternoon. The seated pelvic tilts, same thing. You can do 10 repetitions, even increase it to 20 or 30 repetitions, once a day minimum, either morning or afternoon. Twice a day is okay, every day of the week. For flexibility, the lumbar extensions, you can do 10 reps to start, then work up to 3 sets of 10 reps. Hold them for about a second as you go up, and you can do them once a day minimum, even twice a day, every day of the week. The strengthening exercise, prone cross crawl, because it's strengthening, I recommend 3 times a week, once a day. So once a day, 3 times a week. You start off with 10 reps and then work up to 3 sets of 10 reps. The lean over the cliff exercise for the multifidus muscle and the lumbar spine, you can do 10 repetitions of that and then work up to 3 sets of 10 repetitions. The more that you do is better. So every day, minimum once a day, every day of the week. Exercises like this are great, but you also need to be aware of the warning signs of severe L405, L5S1 disc bulge that may require a visit to the hospital. So this video over here will teach you about those warning signs for advanced severe L405, L5S1 disc bulge. Watch that video right here, right now.